So control of trachoma. Why we should control the trachoma? It's very important for prevention of blindness. So about the host, environmental factors, mode of transmission, you have already learned in your microbiology. The most important in community medicine is about the controlling, to reduce incidence, to reduce prevalence, programs. These are very much important questions they'll ask you. What you have to do for controlling of blindness? First, what we have to do is we have to go to the communities, see the cases of corneal blindness, trachomatis tracheatis, ectropion, and modern infection, like modern severe infections of trachoma. Then assess these cases. Then see, is the problem is due to trachoma or any other organism or any other factor. So first is assessment of problem is very important in the controlling of trachoma. This is the first point, how you have to assess. You have to go to the community, just look after the peoples, communicate with them, ask them what is the cause, see the risk factor, environmental factors, host factors, and then come to the conclusion of what is the real problem. Then is, after getting to know the problem, the second thing is chemotherapy. What you have to do is chemotherapy. See, in trachoma control, the main activity is chemotherapy. Okay. Why chemotherapy is important? Because it reduces the severity of the disease. Like if the person is suffering too much in the mild condition, he should not go to the severe condition. To control the severity of the disease, chemotherapy is important to reduce the prevalence, new cases, old cases, to reduce all the cases. We need chemotherapy. The mostly used here is in tetracyclines are used, rifampicin can be also used, or erythromycin can be also used. So in case of chemotherapy, we have two examples. One is mass treatment, other one is selective treatment. When we have to do mass treatment and when we have to do selective treatment. Mass treatment, when there is prevalence more than 5%. Okay, in case of severe to moderate trachoma in the children under 10 years, you see this condition. There should be prevalence of more than 5% and there should be moderate to severe trachoma in the children of under 10 years. Then you have to undergo mass treatment. So for the mass treatment, you have to use antibiotic tetracycline. So tetracycline is the antibiotic used. How you have to give? See, twice daily for 5 days, continuous 5 days, consecutive 5 days should be given, or once daily for consecutive 10 days. Okay, it should be done each month. So the conclusion is you have to do for 6 consecutive months or 60 consecutive days. This is very much important. They'll ask about how is the mass treatment. See, from practical point of view, one of the main difficulties in this is repeated application of antibiotic for the long time. But like for this, utilizing the healthcare workers, participation of a community made it easy, and there is change in the prevalence of trachoma condition. Then we have selective. When selective is done, when there is low to medium prevalence is seen. So either then community based, like looking after whole community, then giving tetracycline to mass to all the people there. You have to do first screening and then case finding. Like community based going is very difficult, so you have to go case finding. First do screening and then do case finding and selectively give the treatment. Then we have surgical. When a surgical treatment is done? When the individuals undergo disability, that is when there is lid deformity like ectopion. These lid deformities are seen. At that condition, there is necessary for the surgical procedure to be performed and the follow-up. Then we have surveillance. Surveillance is very important in all kind of controlling, all kind of disease control. So surveillance is to maintain, to achieve the control, we have to maintain surveillance. Since trachoma is a familial disease, it spreads in the family, so we have to check after whole family should be kept under the surveillance. Then health education. See, you must know that trachoma, the environmental factors, the predisposing factors, the environmental factors for trachoma is most thing is quality of life and customs. Okay, so mother should be educated. It is seen in mostly young children, right? So mother should be educated. She should say she should be thought about that trachoma is associated with poor quality of life. The disease thrives in the condition of poverty, overcrowding, poor personal hygiene, illiteracy, poor housing, and the customs of like kajal in the ear, like eyes, under eyes, is the most positive factor for that. These things should be educated to the mother. So health education is very much important as the primary prevention condition for a trachoma. Then we have evaluation. So in case of evaluation, trachoma control program must be evaluated at frequent intervals. Like evaluation becomes the major topic to control and prevent ectropion and triasis. So what you have to remember here is the trachoma control program in India was introduced in 1963. Later, then it became integrated with National Program Control for Blindness.